Dr. Thomas Eppes, CVFP Medical Group, is here. Good morning.
Good morning to you.
Now, we are going to talk about a couple of things here, including marijuana. And when you came in and you told us we were going to talk about marijuana, Brian's question was,
did you bring any?
But I think, Biscuit perked up too, I think that's not the direction that you're going with this conversation.
No, my harvest is not in yet. It's advantage living out. It's living out in the country.
That's right.
Where nobody disturbs what you're doing.
I saw that there's one state, and I think it's New Jersey, is getting ready to recriminalize marijuana.
Well, the data about just wide open dispensing of marijuana has been pretty sobering. And the big thing that was just published and this was done out of the San Francisco area, small study, 55 people. But what they did is they compared people that didn't smoke, people that did smoke, and people that use gummies not smoking. And what risk did that have for the vascular health of the people that did it? And it was just like smoking cigarettes. And the people that smoked or used the gummies used it 3 times a week, and which is moderate usage. We have people that are developing a marijuana addiction syndrome that they just can't get off of it now. And they use it every day, and then they get sick from it, and so it's not a harmless substance that you're putting in, and obviously this is another thing that is a chink in the armor of those people that want to legalize it in all respects, and especially of young people. It's doing what smoking cigarettes and tobacco does to you. So we should be advising people this is not a benign process that's going on and substance that's going into your body. And it's not only vascular health for the heart, but vascular health for your head. So
you were talking about the difference between people who were smoking it. Is that right?
And gummies.
And gummies.
Same effect.
It was the same effect.
Same effect.
How is that with not inhaling, whatever particles are in there?
It evidently is. It's not the smoke that's the problem. It is the substance that is the problem.
So is it the same thing with cigarettes, that it's not the actual smoke particles, it's whatever else is in there?
I haven't study that, but most people don't consume tobacco using.
You don't have like big bongs and stuff like that, right. Generally. You're already kind of puffing a little bit more, I guess.
Right. Or just whether you're just inhaling, of a manufactured cigarette from marijuana. But it's the substance evidently is the problem, and so so far in this state, even though it was legalized for recreational use, and if you're a non-distributor, the dispensaries have been thwarted in their ability to put one on every corner as they are in some states.
Well, it depends on what happens in the governor's election. That's probably going to change.
That is correct.
I don't think there's any question. Mary, you were talking about New Jersey, so I've been looking at this.
Yeah.
It's not so much they're going to recriminalize marijuana in general, but what they want to do is have strict penalties for selling unlicensed marijuana. They have very high taxes in New Jersey, according to this New Jersey.gov cannabis page. They don't quite put it this way, but they're raking in a ton of money. As a matter of fact, it looks like they're making, probably $160 to $180 million a year in tax revenue from it. And just to put that in perspective, in Virginia, the ABC, which we all love, and it makes lots of money, is about 270, 280 million. So you can imagine they don't want to just get rid of what they want is more money. If you tax it that highly, what states have seen, whether it's California, New Jersey, I think Colorado, is that people say, you know what, I can go down to that guy that I used to get it from illegally and pay half the price, and I'm just going to go and get it from him. And if it has whatever in it that's, because it hasn't been inspected by the state, I will take my chances. And that looks like that's what's happening in New Jersey too.
Mm-hmm.
Is marijuana different now than it was a few decades ago? Stronger?
Oh, it's
more
much
potent?
Stronger, more potent,
Yep.
much easier to have the effect on a lot less. And so it's a different animal when it comes to its effects. But it also looks like its effects on the cardiovascular system that we have.
I just, we've been having this debate in Virginia for several years now.
It's about 5 years now.
Decriminalizing it, and not only that, but paving the way for people who were once the most susceptible to having it be when it was illegal. You had folks who went to jail because of it, and now they're the ones who are being encouraged to open up the shops to sell it to everybody.
And that's what you're going to get too, because Republicans wouldn't make a deal.
And it just doesn't seem like a good idea to encourage people to, in this kind of, it's a kind of a restorative
justice. Is what it is called.
Restorative justice. To at the end of the day, you're impaired. You're under the influence.
Right.
And the state will basically be encouraging people to sell this to their neighbors.
Well, I understand they're going to have a program to give former bootleggers licenses for ABC stores.
I just,
sure. I mean, it's that kind of thing. I mean, I understand everybody wants to do their, social justice, experimentation and whatever else. But
that people were that the idea was, people were unfairly punished for years, and so now we're going to make it up to you by letting you sell it, and you're selling poison to your neighbors.
Right, and it's also a big industry. It's always interesting that I gave to our local state legislator a book, Weed and Corporate, and it is a very interesting look into the corporate business of marijuana distribution.
There's a lot of big investments in it.
And a lot of people want to be able to do that. So it's a challenge.
That is one of the things you've seen play out in lobbying in states, is that you've got what I'm going to broadly call the marijuana industry. Right. I mean, I know that's overbroad, but nonetheless, who are spending a lot of money leaning on lawmakers to legalize it, and people who are spending against it are tobacco and alcohol. Industries who, well, hey, we don't want that could cut into our profits, and it does come down. You do wonder, does it come down to just who's got the last $10 in, and gets the last vote.
Right.
Now we wanted to talk also about Robert F. Kennedy Jr., our Health and Human Services Secretary, and his vaccine policies.
Right, his vaccine policies essentially. Mr. Kennedy at times seems to believe that there's no vaccine that's any good whatsoever, and that he unilaterally has taken the COVID recommendations for kids and pregnant women off. And I understand some of the reasoning behind the children, especially young males, but for pregnant women, it's been shown to help protect the kids. Most people don't know that there have been 2,000 deaths from COVID in the in childhood age range. Half of them have been children under age of 4, and of those, that half of them were totally healthy kids beforehand. And then it's estimated that at least 1% have the dreaded long COVID, whatever that means. It's still one of those things being studied. I don't mind people saying that we need to study and prove things of that a little bit better, but this has been a very studied vaccine. The bigger one that I have a big problem with is his refusal to say that the measles vaccine is the way you stop the measles epidemic. That we are now past the 1,000 mark. In Canada, they're past the 2,000 mark. Of the people that have gotten it, 96% have been unvaccinated. That The 12% have ended in the hospital. There have been 3 deaths that the death that we had was the first measles death in 20 years, and the 3 deaths are more than we've had in the last 25 years. And people forget this illness is a really zinger of an illness for kids. If you look back into the early parts of the United States, one of the reasons that the state of Oregon was able to be settled by settlers is they brought measles in, and a giant measles epidemic killed half the Indians there. Again, mostly kids, but also affected the adults. The good news is measles vaccine, the measles epidemic usually ends in May. We still, and the trend line is going down, but we are seeing that happen. That they won't support the flu vaccine. Over 200 kids died this year. That 90% of those that died were unvaccinated, and half of them were totally 100% healthy kids because of vaccine skepticism. And a lot of this came about the poor reasoning and poor marketing of the COVID vaccine. People have become vaccine skeptics. And Kennedy will walk around and say, bravo for not vaccinating your kids. Well, we got to get to a 95% vaccination rate to keep it from spreading. I mean, 30 years ago, 25 years ago, measles had almost disappeared in this country. But when the vaccine rates are starting to fall, you're seeing epidemics break out. And even one that most people don't realize is pertussis or whooping cough. Now, it is escalated tremendously over the last 2 years. And who gets whacked by pertussis? Of a very young, like infants, neonatal infants. I know the scariest that I ever had in taking care of kids was a kid that got whooping cough when they were less than 2 months of age. And it was one of those times you just don't forget what it's like to have a child that is 2 that you think is healthy. 2 months that you think is healthy, and then ends up going up to the pediatric intensive care in Charlottesville, where we had to send them because of what was going on.
Had the child even had at 2 months? Have you had the vaccine yet?
No, 2 months is the normal starting point.
Okay. Some comments coming in, and I had a question though following up on the vaccines. What practical effect does it have if the CDC will no longer recommend this? If a woman, say a pregnant woman, goes to her doctor, the doctor can still recommend it.
The doctor can recommend it. The patient can still get it, but the insurance company may not have it. And one of the big things that Kennedy is spouting off with no evidence whatsoever that's valid is the effect of measles and autism. Now, if you open up vaccine injury to autism with the number of people that claim they have autism in the United States right now, that it will make vaccines unaffordable because companies will just say, we ain't going to make something that we're going to get sued about. And this has happened with medicines in the past that will put us in even a bigger situation. Right now, vaccines are for children are covered uniformly by your insurance companies.
We have a question from a listener. Are opioids or THC better or safer for pain management?
The THC is not legal for pain management right now. Opioids can be, but they're good for short-term pain management. Just ask anybody who's ever had a kidney stone whether they would like to have an opioid. I can say that honestly, that it's pain beyond belief. But that the long-term management of like chronic back pain, opioids can be a big hole to fall into. And there are alternatives to that. But short term, opioids work. It's just like a lot of things. Short term, they work, but you have to be careful about what the long term process is going to end up being.
Dr. Thomas Eppes, CVFP Medical Group, thank you so much for being with us today.
My joy.
We'll talk to you again next time.